As you have heard from two of our three Ada County board members and would have heard the same from Dr. Jane Young, this is not a decision that has been taken lightly, but we feel it is absolutely necessary and the time is right now. We recognize the impact this pandemic is having on our communities. Because you can't see the virus, it's easy to become complacent. It's summer, and this is usually the season when we have far fewer colds and flu infections, and it is easy to let your guard down. But as we have seen this past week, it does not take very long to go from having the disease under control to a community outbreak that is of great concern. We'll take some time now to answer any questions you have.
Russ, this is Don with Boise Dev. Can you hear me?
I can, yes.
So when was this decision made? You mentioned being behind the 8 ball. Was this decision just made? I'm hearing that this was being discussed as early as last Wednesday. What took so long to get this out into the public?
You know, that's a great question. So last week, we were really focusing on the bars and nightclubs, hoping that if we took action there, we'd be able to get it under control, recognizing we didn't know what the weekend had in store for us. So we did put together a meeting with the nightclub owners in downtown Boise. That was coordinated thanks to Rocky Johnson, the co-owner of Hump and Hannah's. We worked with them Thursday and Friday to make sure that they had everything in place, including the provision of face coverings. And then by Friday evening, getting reports from Dr. Peterman from the Primary Health Medical Group and talking to Dr. Ted Epperly, who you just heard from, we realized the cases were continuing to rise at a pace that was not going to be good for our communities. Clearly, we're heading in the wrong direction and too quickly to wait. So we met as a Board of Health on Saturday. I met with the Board of Health and we made the decision to implement that the start of this week. So the discussion took place on Saturday afternoon, and in order to get our orders put together, which will be finalized later this afternoon, and also to give a little bit of lead time, not much, so that the businesses that would be affected would be able to make the adjustments they need to.
So I have another question. What about Canyon County? I understand that Canyon County isn't in Central District Health, but it's in the Southwest District Health. Was there consultation? I understand there was. Was there consultation with officials in Canyon County? Commissioner Laciando said, you know, the cities don't have lines. That applies obviously into Canyon County. What's the status of the 2-county region?
So you're exactly right. Ada, Canyon County is pretty much grown together as a community. And immediately after the board meeting, I let my colleague, the director from Southwest District Health, Dr. Nikki Zog, know of our decision, and she was going to communicate that to her board members as well as elected officials. So I'm not sure what steps they may be taking. Certainly they had a different demographic than we have as far as the cases. They were not seeing the more intense clusters that we had going on that resulted in a lot of infections beyond those particular settings, where again, it wasn't the cause by the bars or something there. It was the fact that people went there while infectious. So demographics and infection status and situations different than in Canyon County, but that will be up to their director in consultation with their Board of Health to decide what action they'll take. Other questions?
Russ, this is Ted. If I can just bring up a point or two.
Sure, please, Ted.
Okay. Russ, you may want to amplify, since we are a 4-county district, that we're focusing at this point on Ada County and not the other 3 at this point. And then I'll just make one more point and stop. We also care for, through my organization, the homeless shelters here in town in regards to their COVID-19 infections. We've seen a 500% increase in the number of cases at our homeless shelters in the last week. So again, just to put a little bit of some sort of urgency to why we're doing this as quickly as we can, recognizing that the data didn't really start to come together until mid to late this last week. We definitely want to jump on this right now at the top of this week to try to make sure we do the best we can. The second and last point I'll make, and I'd forgotten to make this one earlier, is that the greatest predictor of how we're going to do moving forward is public compliance. So in the absence of having a treatment for COVID-19, in the absence of having a vaccine for COVID-19, the only thing we can do is to do the public health measures of masking, social distancing, hand washing, and good care of those aspects of this. It's the only tool we have to try to make sure we bring this under some degree of control. So thank you, Russ, for that. And you may just want to amplify that, perhaps the county differences as well.
Sure, thanks, Dr. Epperly. So as pointed out, we are a 4-county health department, but this action is only applying to Ada County. Valley County seems to be doing well. They're not without cases, but they only have a few cases. Boise County, which is just to the north of us, is still sitting at 0 cases. Elmore County, to the east of us, they're a larger population in Valley and Boise, and they've seen their share of cases, but not of significance that would warrant issuing any types of orders outside of what the governor has in place. So we're essentially dealing with Ada County focus, but are prepared to move restrictions into other counties if it becomes necessary. I also wanted to mention we've had a few questions come in from the chat, and one of the questions is related to available bed space in our hospitals. So we do monitor that. We have a public health preparedness team here at Central District Health with close ties and coordination with the hospitals. And at this time, they are doing okay. They are not concerned about the ability to treat COVID patients, but as we've seen in other cities across the country, as well as here in Idaho, in Blaine County, that can change really quickly. So we definitely keep tabs on that, but with this rapid rise in cases, it's definitely a good indicator of what's to come. So we are trying to get that under control, and we'll continue to coordinate with our hospitals. Another question that came in was the impact on restaurants. So restaurants will remain open. They'll remain open for dine-in services. If they do have bars associated with the restaurant, we will require that the bar top essentially be closed. So drinks can still be served to patrons through wait staff, but the bar where people tend to gather will be required to be closed.
Director Duke, are you still taking questions?
Yes.
So what do you say to bar owners who obviously were closed and then reopened, and then some of which spoke out and were a little concerned about the way some things were handled, and now they're being told to close again after they tried to implement social distancing and some of those measures, there's some economic damage to these folks. What do you say to bar owners?
You know, I completely understand how difficult this is economically, both for the business owners and as well as for their employees. And, you know, our responsibility certainly is public health, but we're not lost on the idea of the broader impact. And wish things could be different, no question about it. And I do know there are resources and help available through the state, through the governor's office, and through the Department of Labor. And I would encourage those business owners and employees of those businesses to continue to seek assistance through those resources. You know, the unfortunate reality is when we look at this being primarily a respiratory disease, close contact where you're within 6 feet of somebody for longer than 10 minutes, that's when it becomes highly transmissible. So bars and nightclubs in particular, and they're not, it's not just excluded to them, but they are very high risk. So my hope is through these orders that we can get the disease back in check and see the case numbers decline, and then we'll be able to open things back up again at that point in time. And I cannot emphasize enough, even though you're out at a bar, out at a nightclub, and it's uncomfortable to wear face coverings in that type of environment where you're there to drink and socialize with friends, but that's really one of the few tools that we have. So again, I feel really bad that we are where we are, but we have to protect public health, and based on the rapid increase in cases that Dr. Epperly shared with you and what we're seeing here at the health department, we had no choice.